We have never in this country had a strategy that says this is an important effort to invest in. And in spite of the Congressional Budget Office not scoring this, by the way, I'm not quite sure what data they're reading to develop the formulas, but it makes no sense to me if we know that obesity and smoking are the two underlying causes for most of the chronic diseases, and we have efforts that are successful in reducing smoking and reducing obesity, that it wouldn't pay dividends in our health costs. But we can't quite make that argument compelling enough for the Congressional Budget Office. In spite of that, Congress wisely said, we need a national strategy, we need a national investment, which includes not only money that has gone to each of the states to help move a framework of prevention and wellness out into communities. We have 40 community projects underway aimed at either tobacco cessation or obesity reduction. And we have the most famous vegetable gardener in the world, Michelle Obama, taking on what is an enormously critical initiative, ending childhood obesity in the next generation, because it is not only a costly crisis, it is an enormous health crisis to have 1 out of 3 kids either overweight or obese, and the first generation of American children who are predicted to have shorter lifespans than their parents unless we do something. So all of those initiatives are actually part of this framework going forward. I have said to the folks in our office that passing the bill was not the hard work. The hard work begins once the bill was signed 2 weeks ago, and it really is in implementing the strategies that are contained in this framework. It's making sure that as we roll out the benefits, and there are many, and many that hit this year, that we work closely with community partnerships like those of you here at Balcony to make sure that people who are eligible for those benefits know about them, that people understand what is available to them and what can happen over time, that we get the message out to providers and stakeholder groups to engage in this discussion, and that we make sure that the kinds of cost-effective strategies that we need to promote moving forward aren't undermined by folks who want to or cling to or have a real stake in doing business as usual. Those battles will be there year in and year out, day in and day out, and I think those challenges remain. But we are committed in the Department of Health and Human Services to becoming America's help desk, to not only have information readily available, but to push it out through websites and mailings, through call lines and Twitter and Facebook, making sure that we engage and use all the social media, regular media, partnership efforts to really begin to promote what exactly this bill is about. Because don't misunderstand how much misinformation is out there and how much misinformation was intentionally promulgated over the course of this debate. And it is difficult to sort of cut through the noise and make sure that seniors understand that Medicare, in fact, is stronger in the long run, and benefits are going to be available starting this year but continuing on, that Medicare Advantage plans will continue to be a choice that seniors can make. The small business owners understand that they have actually benefits from this bill and no mandate that will put them out of business in terms of providing coverage unless they have over 50 employees. They don't even fit into the employer responsibility category, but instead have help and support to try and come back into the marketplace or stabilize their support, that families understand, you know, that there are some significant benefits, whether they have a sick child, a child with a pre-existing condition, or about to be 21 or college graduate child, or just looking at the opportunity to retire early and terrified about the fact that that isn't an option because they're going to lose their insurance coverage. People are going to be presented with options that they've never had before. And certainly the millions and millions of Americans who lack health coverage, who never believed that they would see the day when we would turn this corner in the country. 45 years after Medicare, we can finally say that if you are poor, you have coverage in America. If you reach age 65, you have coverage in America. And now we can say to the rest of Americans, if you are in this country and have that opportunity, you too will have health care in America. It's a new day. I think it's a new beginning, a new opportunity to have a healthier and more prosperous nation, and it wouldn't have happened without all of you. So I'm delighted to be with you today. Congratulations. Celebrate this victory, but then help us make sure that we get it right. Thanks very much.